Good afternoon, and thank you for joining us for today's panel discussion on how COVID has changed communications, and in particular, how there has been a power shift in communications influence and what that means for healthcare comms. My name is Sarah Crabb, and I am the president of Agnostic, a communications firm headquartered here in Toronto. Before we begin, I would like to acknowledge the land I am on here in Toronto, which is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, and the Wendat peoples, and is now home to many diverse nations, Inuit, First Nation, and Métis. I also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. It is wonderful to welcome so many of you to our discussion today and from right across the country. We even have some joining us from outside the country, which tells me that this topic knows no borders and has universal appeal wherever you are. A couple of housekeeping things before we get started. This event will be recorded to allow any of your colleagues who can't be here today to catch up on what will be an insightful conversation. Also, thank you to those of you who have pre-submitted questions. We are hoping to get to as many as possible at the end of the panel. However, we encourage you to use the chat function to the right to interact live with other attendees and with our panelists. Today's panel, as I mentioned, will focus on a topic which has been front of mind for most of us as communicators for the past 2 years, and that's the nature of communications in healthcare, and particularly how COVID has upended what we thought we knew. At Agnostic, we focus very much on better thinking to generate better results. And over the course of the last 2 years, on one hand, we had nothing but time to think. And on the other, the world moved so fast that there was no time to think. And some of the results from a comms point of view definitely reflected that. Through COVID, the communications world both collapsed and exploded. And never before, certainly in our lifetime, has there been such a relentless demand for accurate, concise information on a complex subject, which was also outweighed by the supply of accurate, concise information on a complex subject. So lots for us to discuss today. Today also marks the launch of Agnostic's new health offering, led by one of our panelists, Nancy Dale. And what better way to kick it off than welcoming some of the leading voices we heard from throughout the pandemic, and selfishly, some of the people who kept me most sane as a mom and a communicator and a concerned citizen when communications messagings were a little muddy at times. So, to our panel. First up, our host for today is Avis Favaro. You will all know Avis from her incredible 2-decade career with CTV as their medical correspondent. In fact, Avis is not only Canada's leading on-air medical correspondent, but also one of Canada's longest, a 13-time Gemini Award winner, a hugely successful career in broadcasting with CTV. And Avis moved on to her second act in February, and we are thrilled that she is here today to guide our discussion. Next, we're joined by Dr. Samantha Yammine, who most of you may know better through her Instagram handle of ScienceSam. A neuroscientist, a science communicator, and a digital media producer, Sam believes that science should be for everyone and created ScienceSam Media, a science-based digital production agency to improve accessibility to science-based comms. With 138,000 followers on Instagram alone and her breakdown of various COVID-based announcements generating millions of views on TikTok, her message is certainly landing with Canadians. We are also welcoming today Dr. Kate Mulligan, Assistant Professor at the Dalla Lana School of Public Health, Director of Policy and Communications at the Alliance of Healthier Communities, and a member of Toronto Board of Health. Dr. Mulligan has been hugely instrumental throughout COVID on giving a voice to the importance of health equity and the vital work needed to bring communities and healthcare closer together. Working towards the realization of healthier cities and communities through action on public health policy, Dr. Mulligan recently launched the Canadian Institute for Social Prescribing, a new national hub to link people and share practices to improve community-based health and well-being. And finally, we have our own Agnostics SVP and lead of our health offering, Nancy Dale. Nancy has worked at the forefront of health communications for over 20 years. From agency, where she advised C-suite leaders and organizations on vaccine development, rapid testing, virtual care providers, and senior communities, to her role as head of communications at the OMA, where she managed communications in support of physicians in time of contract negotiations and membership upheaval. And we're all hoping for a little less upheaval on our panel today. So thank you again for joining us. We're thrilled that you're here, and I will hand it over to Avis to get us started.
Oh, good. Great. Thank you very much, Sarah, and welcome to all the panelists. I have to say, I started health reporting with HIV. It didn't even have a name at that point. So pandemics and infectious diseases have been peppered through my career. I lived through SARS-1, which was quite challenging. Then we had H1N1. We had the rise of West Nile in parts of Canada. And when COVID hit, I must say it broke every single journalistic rule that I thought existed. The flow of information went from peer-reviewed journals to instant release. We went from normally sane and balanced scientists with a little bit of discord here and there to openly hostile physicians on Twitter trying to make sense of whose opinion mattered the most. It has been the most confusing time, not just for scientists and for public health, but also for journalists. I mean, so I totally am so enthralled with the idea that we can actually learn about how to better communicate. The message that we got early in this pandemic was, we're ready. We know what we're doing. Don't worry. Public health knows how to communicate this. The World Health Organization knows what to do. And we learned otherwise. So I do believe that we can start by talking about how to better communicate going forward, because COVID isn't over, and how we can better communicate in future pandemics. Because healthcare, everyone realizes how important healthcare, public health communications are as a result of COVID. So I'm thrilled to be moderating this panel. We're going to have lots of really good discussions about key messaging and how it worked, what didn't work. And I think that what I'd like to do is start our discussion with some of the questions that we've been discussing in advance. And I think that what I'd like to do is start with a question, and we'll go through all the panelists here, but we're here to talk about the evolution of communications because we now have 2 years worth of this. And when it comes to communications, we have this big C about how the communication happened, how it was targeted, to whom, how did it work? And thinking back over the last 2 years, I'd like to ask each of you the biggest outstanding moment of communications when things were either good or bad, and those seminal moments that we're going to be looking at for years to come. And I'm going to start with Nancy. What do you recall as being the big moment in communications?
Thanks, Avis. I think there's many moments that actually kind of give me chills from the past 2 years, but I'd like to just start by saying I wish I kept a journal, because for me it's really hard to distinguish one wave from another at this point, one season. My son was 7 when this started, and now he's 10, so it's unbelievable how fast the time has gone. Many moments seem surreal to me, like the day the NBA shut their league down midway through a game, or when the hotline was set up to report neighbors having parties. But for me, the standout moment really happened early on, and that was the press conference on March 15th, where Prime Minister Trudeau announced the border closure. There's a couple of slides, I think, on this sort of moment, but it was the tone in which the Prime Minister said, if you're abroad, it's time to come home. It still gives me goosebumps. And talking with friends and family, I know many of us know where we were at this exact moment. It's sort of our moment for our generation, burned into our memories, like previous generations had theirs. Looking back, I think the government did handle this moment very well. The Prime Minister was calm and measured, but it was clear that the world was about to change for us. He spoke in a tone of reassurance, but I made sure not to bring fear and alarm as to not cause mass panic, as I think we can all imagine how this could have gone quite poorly for him and for the government if we invoked any more panic than already was there. And you could see the methodical buildup to this all week, with hints that Canada would soon be in the grips of the virus, as all the data was showing as such. You'll remember the Prime Minister repeated many times that he would not leave Canadians stranded, and he also reassured the public that trade would continue and supply chain would remain stable, despite what happened shortly after with the supply of toilet paper, at least in my neighborhood anyway. It's remarkable if you stop to think about the number of stakeholders involved, from airlines to public health agencies to consulates, all had to be aligned on this unprecedented, there I said it, I think I was the first to say it, move to close borders. And I think, given how many unknowns there were in the situation, it went as smoothly as it could have.
Good. So you liked his tone. You thought it set a good example.
Yeah, some could say, maybe he was slightly paternalistic, but I think in the end, it was the right tone for the moment.
All right. Kate, to you, what was the moment?
For me, it was something very specific. It was April 10th, 2020, so very early in the pandemic as well. And here in Ontario, our Chief Medical Officer of Health at the time, Dr. David Williams, said, regardless of race, everyone's equally important to us, and said Ontario wouldn't be collecting sociodemographic or race-based data about how COVID was impacting different communities differently. Even at that time, we knew that it was very likely that racialized people, Black populations, essential workers, people living on low incomes were going to be disproportionately impacted. In fact, they were already saying so. So this was a watershed moment for me in the work that I do in community health and health policy, because we recognized right away the undercurrent of outrage that resulted from that comment. And so very quickly, I worked together with my colleague, Sane Dubé, who's a leader in the Black health community, put together an open letter calling for the collection of these data, rapidly threw it up on social media, tagged journalists, tagged decision makers, tagged community organizations, and got thousands of signatures. And then within a few days, things had really changed. It was making front page news. People were paying attention to the issue. By May, Toronto Public Health was made the decision to start collecting these data, and by June, it was going to be happening province-wide. So I think for me, it was just really in some ways an offhand comment that captured in all the wrong ways the mood of people and the sense we had that there were equity implications of this pandemic that couldn't be swept under the rug with universalist approaches to either policy or communications. And being able to use social media in that way helped us to have an impact in a way that if we hadn't had access to social media, I really don't think we would have seen the change happen in real time like we did.
Absolutely. Actually, you're part of the rise of the advocate physicians and advocate scientists that we've seen. But let's finish this topic because we're going to talk back a little more about that. Samantha, tell me what was the big moment for you, the pivotal moment?
Maybe I'm having some recency bias, or I've successfully repressed memories for my own sake. But I'm going to say right now, and it's hard to pinpoint a specific moment because for me, it's really the silence on what people can do right now. And I think it's really this moment of silence and this lack of clear communication and the denialism we're seeing right now is the culmination of what we've seen over the last 2 years, where we've seen a really lots of all or nothing messaging. We've seen, even like the just stay home and that was it. Or we've seen a discussion of policy without the link to how individuals living in these policies should act. And so right now in particular, I think of the messaging we're seeing across Canada and across the world think about your personal risk factors and do what you need to do. And I just think of what's not being said for the people who don't really have choices, people who are immunocompromised, people who are at higher risk because they're on certain medications or they're older. There are so many things where we're just pretending like this is now a personal health issue, and it isn't. And I think we're just doing a really bad job at realizing there are things that we have to do for policies, and then there are things we need to tell people as individuals living in those policies. The nuance that they need to actually survive and thrive during this time is completely missing. Finally, we're seeing rapid tests, as an example, in people's hands being distributed without additional cost in Canada, which I'm really, really happy to see. But I haven't seen great communication from the top on how to use them effectively and how to maximize your success. How to, what we've been calling for, take a harm reduction approach. Knowing that zero risk is impossible, we're not going for that. But how can people have fun, refill their cups, especially in the summer months, which we're hoping will be, more chill and less risky? How can people do the things they need to do and protect their health and reduce their risk and be empowered to use the science we have now? It's been a long time. We've learned a lot. These are no longer unprecedented times. It's precedented. We know what you can do. So giving people that information. So I have an example here of a TikTok video I made in consultation with the virologist, Dr. Angela Rasmussen. And it was right before the holidays. I was seeing what was happening with Omicron. I was canceling a bunch of my plans so that I could still get together with my family for the holidays. And I wasn't seeing my friends knowing what to do. So I quickly made this video and released it in time to help people make decisions leading up to the holidays to do what I could. So let's play that video, and this is what I was hoping to see from the higher ups.
Let's talk about rapid antigen tests before the holidays. I talked to virologist Dr. Angela Rasmussen, and here are 2 key things we think you should know. Number 1, test right before an event. Rapid antigen tests or rapid tests can be used for screening when you have no symptoms, but the results are valid for hours, not days. Here's a helpful visual of someone rapid testing negative in the morning and at lunch, and then positive hours later. It's an anecdote, yes, but it tracks with the data. Test right before you head out, and any band counts. And 2, rapid tests are great, but they're not as good as PCR when it comes to catching infections you would have caught in the last 2 to 3 days. That's because it takes at least 2 to 3 days after an exposure for the virus to make enough copies of itself in your body to reach the detectable threshold for a rapid test. That means if you saw a bunch of friends, let's say Thursday or Friday night, and then you take a rapid test Saturday before seeing family, even if you test negative Saturday, you could still be in the unlucky sweet spot of having enough virus to be contagious, but not enough for the rapid test to have detected it. To summarize, using rapid tests right before a small get-together of fully vaccinated people is a great idea. But when transmission is this high, you also want to layer in as many other safety measures as you can, like good ventilation, distancing, masks, especially if any guests had new close contacts in the last 2 to 3 days, or there are any immunocompromised, older folks, or unvaccinated kids around. In other words, I think of rapid test results more like a red light signaling to put the brakes on an activity rather than a green light saying you should accelerate towards more people. If you rapid test positive, you should go get a PCR and self-isolate. And if you rapid test negative, it doesn't completely rule out infection, especially if you've seen other people unmasked indoors in the last few days. And by the way, if you have any symptoms or are a close contact of a known case, you may need a PCR test, so check with your public health unit. Rapid tests are great. I'll be using them this holiday season alongside the many other tools we have to give us enhanced protection against infection and transmission, but only a vaccination will also protect us against severe disease if we get infected anyway. So today is a great day to get a first, second, third, or booster dose.
People want details, they can handle it, and at this point, I think we should be giving it to them.
Interesting. So both Samantha and Kate have illustrated, in my opinion, the rise of people on the front lines of researchers and doctors who found the need to express their voice in what was going on. What do you think the lasting implications are of the physicians and researchers who have come forward to do this? Is this changing the landscape of how we communicate health going forward? Let's start with Kate. What do you think?
I think it is. I think, one thing that has become clearer during the pandemic is the extent to which online participation is in itself a determinant of health. We know that people need access to the internet. We know that people need literacy in using the internet, but we also are learning that this is the new town square, that this is where people have their voices heard and where they hear the messages that are coming there to them. And the systematic exclusions that happen elsewhere can be replicated online if we don't take a very intentional approach to equity. So one of the things that I do, for example, is live tweet the meetings of the Toronto Board of Health. I'm a public representative. I'm there to represent all of us living in the city. And so I just share what's happening. And this improves transparency and access for people. They can respond to me in real time. Sometimes I'm able to share their questions directly with the medical officer of health or with other people. And I'm aware of what's important to people. And there are some journalists and media outlets who are doing this really well now too. We're seeing a rise in independent and community journalism, outlets like The Local that really focus on ensuring that voices of the communities most impacted are heard. They have the expertise, they just don't have the resources sometimes, or the networks. They've been systematically excluded from the resources and networks. So there is a huge opportunity now for us to really focus on ensuring that their voices are and their expertise are at the forefront of discourse online.
And Samantha, when you decided to post that, were you worried about pushback, trolls, anything like that? Or was it just from the heart? I've got to say what I think is missing.
I mean, there are always going to be trolls, but I'm a woman who's been posting about science online for like 5 years. So I would say, unfortunately, I'm pretty used to it. I know how to deal with it. It definitely gets to me at some point, but for me, I'm not there to talk to people who are there to harass me. Like, that's not who I serve. I am here to serve the people in my communities, the people like me, the people who, like me, have never been able to engage with science that resonates with them, that was in a voice. I like to do my science communication like I'm talking to friends. The same way I would call you up and we'd be talking. That's how I want to be in the videos. And I've had people say, you're too bubbly, you're too this, you're too that. I'm like, then it's not for you. That's okay. I'm here for people who want information in that way. And I like information in that way. That's how I learn. So I think finally, we're seeing the impact of that. When I first started communicating online years ago, I had to pitch myself. I had to tell people why this was important. No one really saw the value. And I was in there like telling people what Instagram was so that they would maybe work with me and support my work in some way or let me cover their conference or something online. Now, finally, people see the impact. And where I hope that, what we haven't figured out and what I think we really need to is how to support the people who already have those engaged communities, who know how to use it, who have that voice that resonates. And I really think we need to support those creators or those people who are taking to the platforms rather than, everyone's trying to create their own online presence. And that can be difficult. And you need a nimbleness that I think some individuals can have more than large organizations. So that's what I would say, like where we kind of are right now.
What do you think, Nancy? I mean, nimble is, you're right. You have to be very quick on social media. Is there a change from the corporate end, from hospital communications to using this vehicle for direct communication?
I actually love Kate's reference to the town square because I think it's such a great visual. I don't know what would we have done without social media through the pandemic. It's been interesting to watch, the renewed importance of channels like Twitter, where I think Twitter was sort of falling off for a while. But I used it every day during the pandemic to get my morning updates. But it was also the type of information that became readily available. The clinical trial reporting, much earlier than usual, sort of rolling data sets, virus-related data, very different. I wonder if that openness will continue post-pandemic and if that scientific community will remain as open. There's also the notion of who we define as influencers. And by that, I mean sort of those who hold clout over our moments of decision making. Of course, working in healthcare comms for the last 20 years, we've traditionally focused on physicians, nurses, patient advocacy groups. And I think those groups will remain as a core component of our sort of work. But I think that we can, now look at some new opportunities. It's time to expand who we engage, especially now with consumers more interested in health and wanting to feel that empowerment. And I think this is absolutely a shift that was already underway pre-COVID, with caregivers and patients finally having voices at particular policy tables. But in terms of partnerships, I think, people like SAM, those iconic information powerhouses from the pandemic, what is the role that they can play after in areas beyond COVID? Sam, you're such a wonderful example of this, and I'm so glad you're part of this panel, as you're a bit of a celebrity in Ontario, at least. I love it. But you clearly connected with people in a time of fear and uncertainty. This is likely because people gravitate towards people they identify with. but it's also your communication skills for sure. And in getting to know Sam a little bit over the last few weeks, she mentioned it got to the point where major government announcements would take place and the public would immediately want her interpretation. And to me, that's a huge responsibility, and one I know that Sam doesn't take lightly through our conversations. But her ability to simplify complex information into TikToks it's such an art form, and I think it's a great example of how we can apply some sort of more consumer-focused trends as best practices into the health world, which is a particular area of interest to me. And I think if you were to ask me about 4 years ago if we'd be using TikTok in this way, I would have probably smirked and taken pause. But it's incredible to watch. The content is highly consumable and doing such an amazing job bringing some balance to the misinformation out there, particularly to that younger audience who we really need to reach. And I think particularly on that platform, some of the misinformation that's out there. And interestingly, there's no large institution behind her. Some of those traditional organizations that we see in moments of crisis, I think Sam definitely replaced some of those voices. And I know Sarah mentioned early on that Sam helped her make decisions for her family based on the information. She has oodles of credentials, but she's still extremely approachable and relatable. And I think her ability to move quickly beyond some of the bureaucracy that we see in other places is a lesson for all of us. And moving forward, Avis, I think, what are the storytelling opportunities? Other topics like chronic disease and women's health, I see these partnerships as another way to help ensure diversity of perspective, ensuring our messages resonate with our audiences. And for formal leaders in corporate and nonprofit roles, I think coming back to it, there's a lot we can learn from people like Sam.
Major praising there, Samantha.
Yeah, thank you. That was very sweet.
Somebody said fangirling, Sam, so.
It is important, and I think I see a shift in the way people are recognizing you have to communicate. What communication is, it's about relationships. It's about a face. It's about trust. One of the voices that's come forward is Dr. Isaac Bogich, who we had used in previous stories, but for some reason he was able to communicate in such a clear way. There are, I think, very few people who don't know who he is. And what is it? It's the relationship, not an agency, it's a person, and that's who people connect with. So let's move on to the issue of public health, because we are still in the middle of this pandemic. There are positive signs, but it's still a rough go, and the fall will be question mark. So Kate, to you, let's talk about public health. We all want it to be over. We all want it to be done, but it's not. So we still have children that need to be vaccinated. There's question marks on third boosters, fourth boosters, and then what will come in the fall? Like, are you vaccinated for flu? Will there be another variant? I guess I'm wondering what are the challenges that you see going forward in terms of communicating with public health, given that people are exhausted and they're just done with it?
The main challenge is that the policies and the communications have to match up. And right now they don't. And that's a problem. That's a challenge for people. If people hear, we recommend that you use masks, but see that the policy says you don't have to use masks, there's a point of confusion. And that individualizes what is a collective issue, the public's health, our shared health and well-being. So right from the start, this has been an issue that policies and communications lines have not always aligned. And sometimes they've been misaligned across levels of government or between different health units, but often it's within a single organization or coming from a single person. So I think, it is really important that we continue to ensure that those match up. Even on the Board of Health, for example, trying to make sure that our institution at Toronto Public Health is able to do the right kind of messaging. If they are going to focus on individual decision making, which is a policy decision, they should be transparent about that, and they should provide the information people need to be able to make those risk decisions. But it's not fair to put everyone in an individual decision and take away the tools that they need to make those decisions. I think there are some real challenges. So what we're asking people to do needs to be doable, and it needs to be communicated in a coherent way all the way across.
Right. How do we fix it? How do we fix that communication?
Well, I think the main thing is to just really be aware of that. And it's, one of the challenges I think right now is that the people who are most fatigued are those decision makers, are those people working in public health and in health. They're almost projecting, I think, their own fatigue on the population. I don't know that the population was significantly tired of wearing masks. Maybe the communicators were significantly tired of talking about masks. I don't know, but I think that is part of it. And so one of the things I think we really do need is some fresh legs. We need to bring some new communicators into some of those institutional roles, to bring fresh energy, to bring new thinking, and just to bring less of that fatigue and exhaustion. Everybody needs a break. Everyone needs to change roles and change scenes once in a while, and many people have been going without a break. And so I see the leadership, even in our board chair, Joe Cressy, he's stepping it down, trying something new because of the burnout that he's experienced. I think that's pretty common, and it's rare to see somebody make that shift.
So rotate. What are your thoughts, Sam, going forward? Because there's a lot of public health issues still to be resolved.
Yeah, I really agree with what Kate was saying. And what I would say is a necessary part of the solution is we also got to give people some green lights here. It's been a lot of, I come from a neuroscience lab. We studied the anatomy of motivation, and you can't keep using fear or taking things away and having deficits be the sole type of motivation for people. They also need some positive reinforcement, some good things too. I think where people have been a little afraid, and I get it because you don't want the liability, is to give people the go ahead sometimes. That way, when it's time to pull back, they get it and they trust you. Avis, you talked about the relationship. Part of relationships is give and take. And we've seen a lot of like, no, and we haven't given people green lights enough. Not that there's like a green light to accelerate and just live totally normally, completely, but there have been times last year where I'm looking back and I'm talking to people online, and I realized, because maybe even I was a little shy to share when I was hanging out with friends, because I didn't want to, I didn't want people to take things out of context, or maybe it's more dangerous where they are and I didn't want it to be misinterpreted. So I was a little more shy of sharing the types of things I was doing. But then after talking to people now, I realized a lot of people last summer didn't refill their cups. They didn't do things that would have been safe to do. And in retrospect, safer maybe than now, because there were still other measures in place. So my goal this year, and what I'd love to see from other people, is to try to show like, no, look, I'm still doing things. And right now it seems like a good time. Now I'm going to maybe take that trip or do that thing that I've been waiting to do. And I think that level of moderation has been missing. I completely get it, because no one wants that liability. But at the same time, for those who are willing to step up, I think that's going to be a really important message, especially in the next few months. And I do think that's what Dr. Bogosh does really well. He's pretty reasonable. He'll give people the like, it's okay right now. And then other times when he says no, it's time to stop. It's time to retreat. You listen, because you're like, okay, he's changing too. Excuse me.
And that leads us to another part, is that you have the public health communications. You also have healthcare itself, and the healthcare sector and hospitals and how they communicated. Prior to the pandemic, as a journalist, it was a very free access, relatively free, in that you could go in. And then during the pandemic, boom, everything closed. Thankfully, a couple of hospitals, and I'll give them a shout out, Humber and Hamilton General Hospital, they allowed us in to show, because people need to see what is going on. So the first story that we did showed people being turned over and proned. You got the sense of how healthcare workers were working, or how it was filled with unvaccinated. So let's talk about communications for the healthcare end of it. And maybe, Nancy, we can start with this. How is this going to change it? Because, initially COVID was close the door, and, we're not going to talk very much, and no, we don't want you to see anything, even though it's important, again, for that relationship from your local health institution to speak out in some way. Now, what do you think in terms of health communications that we're learning about that during COVID?
Sure. I think it's a good point, though, that, Sam made. We're still in it. And so I think what we're seeing on the news now is this desire to move away from showing some of that stuff. But that's partly why it's, out of sight, out of mind. But we forget what it's like on the front line, still dealing with COVID in the hospital. So I think that's a good point. But I think, Avis, we talked about this earlier. It's going to take a long time to figure out what we actually learned through this period. And there's still a ton of work to do in the immediate term. Like we just talked about, the 5 to 12s, there's a huge amount of that population that still have to be fully vaccinated. And I think, we're missing on some of that sphere of parental influence, perhaps, where we could be digging a little deeper on that and making some more plays in that space. The misinformation around kids is still, at least in what I'm seeing on the sort of my friend circle, is still quite huge. And I think we should be preparing now for that under 5 group, priming mother and child play groups, nurses, pediatricians, building trust with community leaders and parenting influencers, I think we call them now. But I think in the longer term, the pandemic has taught us 2 things. Many things, but I think the importance of being prepared and the importance of transparency. On the first, unfortunately, the importance of anticipating a future crisis. As much as we'd like to, as we talked about, another pandemic or another challenging time is likely around the corner, hopefully not too soon, but it really demonstrated the power of preparedness and accountability. And while I do think organizations and people tried their best, especially in the early days at least, the pandemic showed us what we took for granted and how unprepared we truly were. There was no playbook for this. I once sat on a pandemic preparedness committee, and I can tell you that none of that work, at least to me, appears to have prepared this for this reality. So we had to learn not to speculate under so much uncertainty. As hard as that was, we always like to have something to say, but sometimes saying nothing is better. With a new virus, new treatments, and evolving guidelines, I think it's important to acknowledge when we don't know the answers. And I think that's actually part of the beauty of science. In the end, talking about leadership, people will be led by those they trust. And I think authenticity and transparency will continue to be key leadership qualities as we continue to move through the pandemic and beyond. Let's face it, in the end, the less backtracking you have to do, I think the better off you'll be. So that's just something to keep in the back of your mind. And I think of something that gets forgotten is internal comms. It's becoming a challenge. I think we're taking social media aside, but just generally internal comms. It's becoming a challenge for leaders to balance empathy with business needs as turnover and burnout continue to be an issue, especially on the front line. So I think moving forward, we have to make sure we're listening and responding to the needs of our audiences. And I think now is our chance with the role of comms in the spotlight, especially as health communicators. I know there's a lot on the line here. We need to push boundaries and help our teams deliver more. As we've seen what we can do in the last 2 years, when sort of some of the rules and guidelines sort of get thrown out the window, there's a lot that we can actually achieve in a positive way. It's a real opportunity.
Yeah, so let's pick up on one point on that, Samantha. The idea of getting parents and children comfortable with the idea of vaccinations. That's still a key point here.
Absolutely. And I think the thing that I learned from parents so much, like they are so interested, they want the details, they want the information, they're curious. And I think we have a paternalistic way about healthcare communications a lot of the time. It's one way, it's like, here's what you need to know. Parents don't really want that. They're some of the parents I speak to are so well informed and know so much, and they're following every detail. They're also getting some misinformation that's not their fault. It's filling in the gaps where we're not engaging. Those disinformers are really good at engaging and doing that. And so when I think about what's next, especially thinking about what's on the horizon for the younger age groups, it's the cardinal rule of communications is that we are not just sages on a stage talking one way. The biggest benefit of social media is it lets you talk back. It lets people talk back. It lets you have it back and forth. Of course, that can be awful sometimes, but it's a real opportunity for people to change their communication strategy in healthcare from we're just going to put this information out there to we're going to talk. We're going to hear what you're actually worried about, that thing that you heard about that you don't know if it's true or not, or you think it's not true, but you don't know why, and you want to be able to understand it and explain it to your partner. We're going to tell you. And so I really want to see, especially when it comes to parents, they're engaged, they're deeply invested, it's their kids. They want to have those detailed conversations. They want you to put to rest that thing that they saw online that they know isn't true, but it's still in. I talk to so many parents every day that they're like, I know it's not true, Sam, but I can't get out of my head. Can you tell me why I shouldn't pay attention to this? And I tell them simply in a minute and it's done. So just that listening and that talking back and that conversation, that's what we really need.
And Kate, what do you think? I mean, that again points to relationships. Can healthcare systems be able to deliver those messages when, that kind of relationship we're asking questions? Sorry if it's a bit garbled there, but you know what I mean?
I do. And in fact, community health really is all about relationships. And that's where I work. And that's something that I think was really, really missing, especially early on in the pandemic, when we defaulted to dusting off the old command and control emergency plans from 5 years previous. They did not build in equity. They did not build in relationships. And even now, when I'm talking about how to have an impact for the communities who face the biggest barriers for health, I'm often asked by people in big institutions, but how do I know who my community is? And I say, you need to have the relationships. You need to already have that built into your structures and your supports. And so we often take approach in public health that I think is really useful in communications as well. It's called targeted universalism. And it means you have a universal goal, like getting the most people vaccinated, but that you target the resources and the relationships that you have to where they're most needed. And so you can have a range of communicators who have a range of relationships with a range of communities and can have those dialogues. And one excellent example of this was the COVID Black Scientists Vaccine Equity Task Force here in Toronto, who deployed their expertise and their relationships over a nice long period of time and spent time listening to communities who had, in many cases, significant reasons to distrust large institutions, government, health systems, and to sit with them and to listen and to share expertise in meaningful ways. And they had an impact. Vaccine rates went up in the communities they worked with. That's the kind of targeted universalism we need going forward. It's entirely doable. We could be doing the vaccine conversations literally one-to-one. We could have primary care teams phoning everybody, going door to door. We could have vaccine clinics set up in schools, during school time, in libraries, and other places where people are, meeting people where they're at. And this is where I say the policies and the communications just need to match up. And if we know who the people are, if we have those relationships, it's a lot easier than it sounds. So it's time now to start building those into our future pandemic plans, so that we can use established, trusted relationships rather than trying to make new ones on the fly when a new emergency arises.
Great points. I mean, I see everybody's head nodding at the same time because we're all in agreement. I would also like to do a shout out to organic efforts that arose, like Vax Hunters. What an amazing idea that someone would say, let's help people get vaccines and make it cool and have that whole purpose unfold. Halo, which was doing something along the lines of you were doing, Samantha. They were trying to explain the science of vaccines. Also very big on Twitter. There's new ways of communicating. There's new ways of tapping in, and people loved it. I would be getting, texts from people. Vax Hunter says this and that. It almost seems like we have to throw away some of the old concepts of communicating and shift, because things are going to move quickly in another direction. I pray we don't get another pandemic. So now we're going to move on to some questions from the viewers. So I'm going to throw out some questions here. Now, these are some that were submitted in advance, and the first one actually comes to me. Can you talk a little bit about what it's like as a journalist with information moving and changing so quickly? How do you take care to understand and reflect on the information when it's so new? So one of the things about CTV was that early on, I was actually afraid that bird flu was going to be the big concern, that bird virus would mix with a human flu virus, and we would have something where we had no immunity and no vaccine. So we hired an infectious disease physician who guided us for about a decade to help us with that, to try to understand because it's so complex. But again, COVID, we've discovered that so many people have different opinions on how to approach it. You had the Great Barrington document. You have former public health officers who had a different opinion, zero COVID, whatever. I think that I really look forward to the learning on how we're supposed to do that. The best thing I can say is that the news media is built on now, here and now, and immediate crisis relief. And what a pandemic requires is context to putting it in the big picture. What is my personal risk, but what is society's risk? And that brings up some of the things that Kate has talked about. We have to look at everyone. The health of the population, the health of the world matters. And I'm not sure how well we did on that. I'll look for the scorecard in a little while. But it's been hard. I certainly have learned a lot about crisis communications in this respect, and we will go forward. I mean, I guess I'll throw it out to you. How do you think the media did? Best they could. There's been criticism that the media was, not balanced enough. That we didn't present both sides. We were just with public health. Kate, what do you think?
Well, I think like anything, the media is sort of a reflection of the networks that it represents. And I think the media, especially early on, wasn't particularly representative of who we are. And that showed. And I think over time, we've improved in our ability, and the media have improved in the ability to speak to the people who are impacted, to use the expertise that's there in communities that are impacted. So I think for me, that's the one thing that has changed and improved over time. Although I do feel that this, like Sam said early on, we're in a moment now where it feels like some of those gains are being lost, and that we're getting into a sea of disinformation and a strong desire by many to go back to their old normal that won't serve the rest of us. So I'm concerned about how sustainable some of those changes might be.
Yeah. Okay, let me move to the next question. Do you think that scientists and politicians, or politicians, are the best people to communicate public health messaging? Or should there be some kind of a health communications office that handles the messaging? Samantha.
I mean, there are communications offices within our, federal government, for example, and within, all levels of government. I think the issue is that when we have the politicians delivering the message, it gets blurred where the message is coming from. So a lot of the times you'll hear people say, well, especially for the last wave, well, the science wasn't working. The vaccine passports didn't work because we had them and we still had a wave. And people just take what the politicians say as like what the science recommended. When they think deeper, I think they realize, like, obviously, no, that's not the same. But I've heard so many people being really unsure where the guidance is coming from, where the decision, especially when the politicians say, this is based on the science. And it's like, well, actually, it's not. So however this experiment turns out, that's not how we designed it, So I think the issue when you only have but that's also how it works. Like the politicians set the policy. It's supposed to be in part based on science, but policies are based on lots of other things too. And I think when we don't have a clear separate entity, it becomes hard to know where those lines are. They become very blurred. At the same time, scientists aren't equipped to do all of that public facing comms. It's not their main job. I don't think we want it to be all of their main job. So yes, it'd be great. What I think would be ideal is to have communicators, like whose expertise it is to do crisis communications, working with all of these people and being really clear on where things are coming from and what the rationale is, so that we can have some understanding of all the factors at play instead of having it be so blurry. But having that nimbleness within government, I can tell you, it doesn't.
It's hard to do. Nancy, I can see you nodding on that one. What are your thoughts on this?
Yeah, I mean, I guess the bottom line is I think we're dreaming if we think politicians won't play a role in these high stakes situations, because in the end, they'll be judged on it, right? So I think, though, the message is that we need to have communications professionals embedded in some of these places. And, of course, there's political advisors, but I think if you take NACI as an example of a government body, the communications around that particular vaccine recommendation, it was not great. And, it's one of those memorable moments that I could have mentioned at the beginning, but I think moving forward, NACI not being used to being in the spotlight like that, from a public perspective, I think there's some definite learnings there as to how to package information out for the public and what that means to politicians on the flip side.
Right. I maybe at the end of this, I'll ask you who did it right, but I have another question from the audience, and this is for Sam and Kate. For the future, how do different levels of government, public health better align for that more consistent communication? Is it even possible?
So
Okay.
I'll start on that one. I mean, yeah,
We've got about 8 minutes left, so keep it short. Let's see how many we can get through. Go for it.
Yeah, I mean, I do think it's really important to think as locally as possible in these times, because the policy, the practice, it looks different. The outbreaks look different at local level. So I think it is really important that other levels of government are there to support the interventions at the local level. And let's be clear, it isn't a dichotomy between science and policy. Social science is also science. And I think one of the disservices that has happened during COVID is that we've somehow separated the two, and decision makers haven't been transparent about what goes into their decision making. It isn't just a graph. It's weighing the risk, weighing what people are willing to do, thinking of all sorts of factors. And that is the role of politicians, and that is their expertise. And so they do have a role, and I like seeing them there. And we want to see their humanity. And I think we have for many of them throughout this time. And I think that's important too. But to align those better, we need to think locally and then provide the wraparound supports at those other levels of government.
Samantha?
Can I quickly add that I think we also need some political communications, right? We need people to realize who is responsible for what decisions, because often you'll see different levels of government pointing fingers at the other. And I think if we all had a deeper understanding, myself included, not having taken any political science courses, I think if we all had a bit of understanding of whose role is this, what actually is NACI's role, they're making recommendations across the country for the provincial people to then implement based on what makes sense in their local context. But it's very unclear what everyone's role is. And I think we also need that form of education as well.
Right. This one for Nancy from a viewer. Have you seen a shift from employees looking for fact-based communications over more empathetic or emotive communications during the pandemic? Because this has been very rough on hospitals and healthcare teams.
Yeah, I think I mentioned earlier on, I don't think it's one or the other. I think it speaks to that need for authenticity. So, as a leader, I mean, I've had some great leaders in my life who truly care about their teams and want to bring down fear and reassure, but they do it in a way that's not patronizing, which I think is the key. It doesn't mean sugarcoating, but it means committing to that sort of culture of transparency from day one. And I think you can build that into your organization so that when you do have some tough news to deliver, it's an open conversation as to what it means to your team, your employees. It just really comes back to that culture building in good times and bad, and leading from a place of empathy.
Right. Okay, and I think one of our last questions here is the bigger issue. Prior to the pandemic, I felt that there was a really good, steady movement towards patients being empowered, learning, Dr. Google, whatever, but being aware of what's involved in their own medical care. Do you think COVID set that back, or do you think the trend now is towards more patient empowerment because of what's happened? Let's try Kate first. What do you think?
I'm hopeful that it will continue to lead to more empowerment for people. I think that we have the ability to talk about our own experiences to others and to find peers online. And that alone will be a support for people who try to grow this, even though there will be, political swings and shifts along the way.
Samantha?
We need more patient involvement for sure. Patients should be at the center of their healthcare decisions, and our typical healthcare communications and even practices doesn't center that. And I will just say again, the reason Goop is successful, the reason that people putting anti-vax disinformation are successful is because they prey upon the gaps in our communications, they prey upon the fears and the very valid dismissal that many groups have had and the mistreatment that they have had. So we don't need to just like build back trust. We need to really involve people and earn our trust for the first time. And I think COVID has demonstrated that. It's always been clear, and I hope that we take that seriously moving forward.
Right.
Avis, to jump on that too. I think some of the most successful projects I've seen, at least from a public relations, public affairs perspective in my career, have been the moments where we've convinced organizations to sort of suspend their agenda and do some active listening. So we're taking out sort of what we traditionally do and listening to the patient or the person who's behind the disease or what have you.
Right. And do you think it will be a bigger challenge? Because what I'm hearing now from physicians on the front line is backlogs, waiting lists, liver cancer patient who for 20 years went for screening. It was upended because of COVID, returned only to find he's now stage 4 cancer because everything was held back. Do you think patients and the communication for patients, they just won't want to communicate because they can't? Or do hospitals and health teams and public health have to get them to communicate a new system for that kind of discussion? Nancy?
Yeah, I was going to say it's interesting. We've had some of those conversations in the last few years. And I think in the end, patients are so grateful for the care that they're getting because it's so personal that they're very hesitant to talk negatively about. And I think they try and block it out. But I think it is coming to a bit of a head with these wait lists and, surgeries put on hold. And I have a friend who's had their surgery rescheduled 3 times. That's a lot of mental anguish for the families and communities. So I think it's an important consideration for sure.
Right. Okay. And before we wrap up, I'd just like to ask you each a question. Lesson learned and what you would like your audience to take home in terms of COVID changing communications and what we do better. So you've got like 30 seconds each. Let's start with Kate.
Be transparent and be real. I think people want to know that you're in there as much as they are slogging it out. So be who you are, share who you are, have those relationships, and just be really honest about where you're taking things. That's what people expect from you, and that's what we need.
Nancy, your turn.
I think let's be open to doing something different. Let's dig in and move forward with different relationships and different ways of communicating using channels that perhaps we dismissed in the past, as I said. So, yep.
That's it. And Samantha, last word to you.
My biggest rule is listen. Whoever you're trying to reach and whoever you want to engage with, not just talk at, listen to their concerns, listen to what they're asking, listen to what they're curious about, and have conversations.
All right. Well, I want to thank everyone for this panel discussion. I mean, my brain is working on how do we help learn what we've all been through in different aspects of what's going on. But clearly, there's a lot of learning to do, Anyways, I'd like to thank Kate and Sarah and Samantha and Nancy for this panel discussion and Agnostics for setting it up. I hope that we're going to be discussing more about how to do it, what we learned, how to do it better as we go forward, because we might get a reprieve in the summer, but I think we'll be back at it in the fall, and if not COVID, something else. But anyways, I want to thank everyone who's watching in and, wishing that as we go forward, COVID goes away. All right. Thank you all, and there will be a recording provided. Agnostic will have a link for people who are interested in getting more information, and thank you all for joining.